Sharon Anderson, so happy to present at What's Up Doc 2022. The COVID-19 has particularly affected older adults in need of care and those providing the care needed. Meeting the needs of this growing population of older adults with complex conditions is highly dependent on family caregivers working with healthcare providers. The aim of this study was to assess the impacts of 18 months of the COVID-19 pandemic on Alberta's family caregivers. COVID-19 increased family caregivers' care work and the complexity of care. These family caregivers were caring for very frail people. 55% were very frail and 30% have frailty scores of 4 to 6. Caregivers note that the frail scale picked up physical disability, but not the care needed by those with mental illness, brain injuries, or mild dementia who needed a caregiver to manage their affairs. Distress increases when care increases to over 21 hours a week. And so you can see by the graph in the upper right, 80% of those caring for someone living with them in the same home were caring for over 21 hours a week. The results of more complex care and longer care, we see rising anxiety and loneliness. Before the COVID-19 pandemic, family caregivers were at much higher risk for loneliness and anxiety than age-matched controls. We need to pay attention to anxiety and loneliness because they are closely tied to the increased risk of chronic conditions and premature mortality. In fact, loneliness has the same risk of premature mortality as smoking 15 cigarettes a day and being an alcoholic. So what can you do? Just asking family caregivers how they are and signposting them to services like the Alzheimer's Association or Caregivers Alberta can be therapeutic. The survey's online, caregivercare.ca/research.